And then we'll follow up with him and see how he's doing after 5 days of consecutive treatments. All right. Yeah, that was a loud one.
A lot of movement.
Yeah. All right, lay on your stomach. How's everybody doing out there? So we have Parker here.
Yep.
Parker came here all the way from Sacramento, California. For those of you that don't know, I'm all the way on the other coast, the East Coast, New York. Anyway, he has a case of costochondritis, and he's been doing some of the stretches we've given him, but he's had some flare-ups, right?
Yep.
So what we're gonna do with this video is he's only here in town for a week. So we're gonna track him over the course of a week. Today is Friday. We're gonna see him hopefully tomorrow, Saturday, and then next week, as many days as we can see him. And we're gonna track him over a 1 week period to see how he does and how he fares with his case of costochondritis. So we just did a brief exam here, and I found something unusual. Well, not unusual, but I found something that probably most doctors would not have caught. He had a shoulder injury on the same side of where his costochondritis pain is, which is the left side of his chest and his upper back. Had a shoulder injury, and I looked at his clavicle, and I noticed that something was off, and I didn't know whether it was the left or the right shoulder, but I knew that he had a shoulder injury. And sure enough, his clavicle is much, much lower on the left side, and I'm going to show you guys right now what I'm talking about. Actually, let's have you stand up, Parker, and pop the shirt off for me.
Yeah.
Ladies, we'll leave his phone number in the description below. He's single. No, I'm kidding. I don't know if he's single or not, but okay, so look at this. So when we zoom in here, yeah, drop your arms. So when we zoom in here, you can see my thumb is much higher on the right side. Now, typically when you dislocate or subluxate the clavicle, it usually goes higher, not lower, but in his situation, it dropped down, and that's why you can see his clavicle. You don't see it here. Nice smooth edge here. You see how his clavicle pops up right there? So see there, nice and smooth. And if you look closely, we probably have to zoom in to see that, but it's a little bit higher there. And again, you can check right here by just lining up the thumbs, and you can see this side over here is much lower. So we're gonna correct that. We're gonna also correct his costochondritis. So I'm gonna have you lay on your stomach.
Okay. You want your arm to the way?
You can leave it on, off, I mean. Okay. So you see some bruises here. He's had some cupping done. I'm gonna give you advice on cupping. There's a couple of new cups that are out. Have you seen those digital cups?
I have not.
So there's a couple of cups that are digital where you can actually put them on yourself. And I did a video reviewing one of them called the Cupper. Slide down a little bit for me. And it's a pretty neat product. It uses laser with cupping technology. And you just charge it up, and it's got like 5 different settings. And then there's another cup. They just sent me the product this week, but we haven't reviewed it yet, called TheraCup. So there are some options out there where you can kind of just, especially if you have a roommate, you can just kind of put it on your own back. The cupper you can put on your own back and just press the button. It'll just automatically suction to your skin, so you'll be able to reach these areas on your own. So folks, you're watching here, what I'm doing is just releasing all the soft tissue. Now, he had a shoulder injury on this left side, but I also noticed that his spine shifts, and it looks like he has a little bit of a right curve to his spine. It's so slight, very, very slight, and it's not easy to see with the naked eye. I've been doing this for over 20 years, I can tell. So I had mentioned to him that we may want to take an x-ray if things don't improve or if things don't get better. Not a chest x-ray, which many people get with costochondritis, and that's not going to tell you anything. That's just going to rule out any more serious heart conditions or cardiovascular conditions. So with him, we may end up taking an x-ray. And if he does have a little bit of a curve in his upper back and his spine, it's very, very minor. How you doing here so far?
Good.
So what have you done so far for your case of costochondritis?
I've done a lot, honestly.
A lot?
Yeah.
Injections?
I haven't done injections. That's the last kind of part I would ever want to get to. I don't want to get
Okay.
to that point.
Have you done over-the-counter medication?
A lot of ibuprofen, muscle
Okay.
relaxers.
Muscle relaxers, okay.
Yeah. A lot of melatonin to go to sleep.
Melatonin, okay. So you're having a hard time sleeping?
Yeah, definitely a hard time sleeping.
Yeah.
It gets worse when I lay down.
Yeah. So even when even when you're doing sports, right?
Yeah, I mean, I can feel like I wake up in the morning and I know if it's going to be a good day or not. Like,
Yeah.
if I can work out or if I can't work out.
Costochondritis is no joke. When it's really bad and it flares up, it affects every aspect of your life. Take care of it. Do the stretches on some of the other videos that I've showed you guys. But if it's a severe case, you might need more like he does. But, it can be debilitating if it's affecting your sleep, your inability to be active, it's your ability to work. It's everything. So what we're going to do for him, since we only have a week here, we are going to laser you, okay? I'm not even going to mess around. We're going to pull out everything that we have because we only have a week. It's not a lot of time to get you better, okay? Another option is we have the rental lasers. So you can rent the laser tomorrow and take it with you.
What do the lasers do?
Laser reduces inflammation, reduces muscle spasm, especially in those severe cases, and it's going to get all the way down into the costosternal joint. Here, so you've done medication, you've done everything else, massage, cupping. How about acupuncture?
Acupuncture, yes.
Acupuncture, okay. Not chiropractic though.
I have done chiropractic. Yes.
You have, okay. And has anything helped you?
I think the chiropractor actually helped.
Helped you the most?
Probably the most, yeah.
Yeah.
Massage.
Which makes sense if you understand costochondritis and the ribs and the anatomy of it. So I'm going to use this machine. It's going to be a little intense. So remember how you said the cupping was strange because it bruises on the right side where you don't have as much pain. So what that means is there's more toxicity in the soft tissue on this right side, but your pain is on the left. And the reason for that is because I feel your spine shifting to the right. So these muscles here are pulling tight, and that's where you get that lactic acid buildup and substance P, and that's why it's turning red here on this side. So not that surprising. So I could feel it's right here, the little bit of a curve you have. So we're going to go ahead and have you take a deep breath in. Good, and blow all the way out. Excellent, and again. And again, deep breath in. Okay, turn over on your back. Now what I want you to do is raise your hands up in the air. Yeah. Okay, relax your arms. We're going to adjust your shoulder right here after we adjust your neck. Just relax yourself here. You get headaches at all?
Nope.
Okay, so you all saw his clavicle and how much lower it was on the left side. So we're going to go ahead and adjust that. Unfortunately, we have to have him turn with his back facing you folks. So you're not going to be able to see it, but we'll go ahead and show you the after effects. So you're going to lay on this side. Okay, lay on your back. Now, let's take the good arm. We're going to just muscle test it here. So, palm out. I'm gonna pull out this way. I want you to resist me. 1, 2, 3, resist. Good. 1, 2, 3, resist. Good. Any pain when I did that?
No.
All right, now the other arm. So what I'm doing is I'm checking your pec major clavicular and your sternoclavicular joint. And 1, 2, 3, resist. That was weaker and a little bit uncomfortable.
Yeah.
And 1, 2, 3, resist. Okay, and that was weaker too.
Yeah.
A little bit uncomfortable for you. Not painful, but a little twinge.
For sure.
Okay, so we're gonna go ahead and adjust this again. Okay, folks, so you see here we're doing cold laser therapy here for the costochondritis. We have a couple of different lasers here, but we're treating each spot for about 1.5 minutes because this is a 25-watt laser. Out here, though, he has some inflammation out towards the shoulder more, where he injured his shoulder, so I'm gonna get a different laser for that. That laser helps me find areas of inflammation and soft tissue damage. So this laser helps me find areas of inflammation. And let's see if we have any battery life. Yes, we do. I'm gonna run this over the AC joint, and there you go. It beeped right over the AC joint. So I'm not surprised, but most of you with costochondritis would not have a shoulder problem or an AC joint problem. He does because he injured his shoulder playing basketball.
Yep.
And then we're going to go ahead and scan here into the pec major and now the pec minor, and that might beep the pec minor. There we go. So the pec minor beeped, there's some inflammation in there, and we're going to be doing this each day, adjusting him, also doing cold laser therapy, and a lot of the stretches he's already doing, so I'm not going to, I'm not going to harp on those too much. And for any of you that are interested, we've done 2 different videos on costochondritis stretches, 3 of my favorite, and then we did another video with 22 different costochondritis exercises and stretches. Have you seen that one?
I didn't see the 22. I saw the 30.
Yeah, that one's big. That one's got a bunch of exercises in it. So if you've done the 3,
Yeah.
we'll send you the other video so you can get started on some new stretches. And your pec major just lit up there.
Yeah.
So, this will tell me how long to dose for as well. So this laser really takes all the guesswork out of it and makes it easier for the practitioner. And typically treatment times with this laser are a little bit shorter than that one because this is a 50 watt, that's a 25-watt laser. And the power has everything to do with the treatment times. There we go. All right, let's have you stand up. Let's take a look at that clavicle and the alignment of it. Okay. Now it's probably not going to be 100%, but actually, that looks 100% to me. What do you think, folks? Look at that. It's slightly higher on this side, but a lot better. We're going to keep working on that all week. Thanks for tuning in.